Hi, and welcome to the learning module for how to use the Investigating Environmental Contamination Guides. There are two guides. The original guide is from the Great Lakes Center for Children's Environmental Health, and it shares resources for investigating environmental contamination with the use of mainly nationwide tools. We will refer to this guide as the Great Lakes Guide throughout this module. The Minnesota Department of Health created a supplement to complement the Great Lakes Guide by providing local data and resources to help Minnesotans when they have concerns about contamination in their community. We will refer to this guide as the Minnesota Supplement. So why use these two guides? The guides were written to empower community members to access information about the environment and health, and to use the many public data sources that are made available by Minnesota state agencies. The guides also provide information on who to contact with questions about health and the environment. So when would you use these guides? This learning module walks through examples of common questions people have about the connection between their environment and health. We will also show you how to use the guide to help answer those questions. This guide is for you. If you have a question about whether contamination is affecting your health or the health of members of your community, if you wonder whether a source of contamination is affecting the air, soil, or water in your neighborhood, or you are just looking for information or experts to discuss an environmental concern with. We recommend looking through the Great Lakes Guide for background on pollution and health first. This guide provides examples of federal data and resources and has information about advocacy and how to bring local environmental health concerns to policymakers. Use the Minnesota Supplement to access Minnesota-specific data and resources. Minnesota agencies work hard to make statewide environmental and health data available and support their use. Next, we will consider several examples of different situations where people have had questions about the connection between their health and the environment. We will explain how to use these resources in the Minnesota Supplement to find information and answers. One common question that we hear relates to what seems like an unusual amount of cancer in a group of people. You may be concerned that many neighbors have cancer. You may wonder if something in the air, water, or soil caused the cancer cases. The Minnesota Supplement has a few resources that may help when cancer concerns come up. Questions about what causes cancer and environmental factors that may play a role are common. MDH has resources with information about the connections between cancer and the environment. The information is based on common questions we receive. It is normal to be concerned if you notice many people in your neighborhood have cancer. Unfortunately, it's not unusual to find numerous cases of cancer in a group or an area. We hope information about cancer and the environment on our website is helpful. Please contact us if you have questions or want to report concerns about cancer in your community. Cancer is a common disease. Thousands of Minnesotans are affected each year. Every state in the nation has a reporting system to learn about cancer. The Minnesota Cancer Reporting System, or MCRS, collects cancer diagnosis data to understand and make decisions about cancer prevention and control programs that can help prevent cancer and reduce its impact on Minnesotans. Occasionally, MDH staff explore MCRS data to understand cancer rates in specific defined locations when a community is concerned about apparent increased cancer risks. Although MCRS data help us understand how cancer impacts Minnesotans and which populations are at greatest risk, the data are not designed to document increased risk due to specific causes like environmental contamination. MCRS staff can provide information about cancer occurrence in general and explain how the MCRS data is used. On the Minnesota Public Health Access portal, you will find data collected through the MCRS. You can see summaries of the data through the View Data page. This has information ready for you. You can also explore data through the Data Queries page. This page allows you to look at and compare the county and state level data. There is also information about the data, how it is collected, and how it can be used, as well as the limitations on its use. In this example, someone wonders if asthma rates are high in their community and if something in the air may be involved. The Minnesota supplement can be used to look for asthma data to see if there is evidence of an unusual amount of asthma, explore air quality data and tools, and advocate for positive change. Depending on the situation, the first step may be to learn about asthma and pollution. The Great Lakes Guide describes different air pollutants regulated by the US EPA, which are monitored regularly. Two key pollutants that affect asthma are ground-level ozone, the main ingredient in smog, and particulate matter, found in smoke, dust, and vehicle exhaust. Knowing about potential outdoor triggers of asthma can help determine whether a community may be disproportionately impacted and may help community members protect themselves. Asthma is a chronic disease of the airways that makes breathing difficult. Asthma can be challenging, disruptive, and frightening for those who have it and for their family, friends, and caregivers. Asthma is different for everyone, and its symptoms and onset varies greatly from person to person. With proper treatment, people who have asthma can live normal, healthy lives. In this section, you will find resources for Minnesotans that will start you on the path toward learning more about asthma, how to manage it, and live well with asthma. The Minnesota Public Health Data Access Portal can show whether a location at the zip code level may have greater rates of asthma hospitalizations or emergency room visits in comparison to other zip codes, the 7-county metro area, or the state. Other asthma data is also provided for exploration and comparisons. Clean air is critical for every person in every area of the state. It can improve the health of residents and decrease healthcare costs. The Minnesota Pollution Control Agency, or MPCA, strives to ensure all Minnesotans have clean air, regardless of where they live or work. Overall, pollution levels have declined considerably over the past few decades due to environmental regulations, technology improvements, and lifestyle changes informed by a growing awareness of the health impacts of air pollution. The MPCA operates a network of air monitors at more than 50 locations around the state that constantly measure pollutants in outdoor air. Using monitoring data, the agency can track pollution trends over time and show whether outdoor air meets air quality standards and health benchmarks. In addition to monitoring data, the MPCA also provides interactive statewide air emissions data, air emissions by facility, and tools to evaluate health risks associated with air pollution. While we are fortunate to enjoy good air quality in Minnesota compared to other states, some communities are disproportionately affected by air pollution. These include lower-income communities and Black, Indigenous, and communities of color. Asthma disparities in Minnesota are driven by a variety of complex factors, including structural, social, and political determinants of health, such as racism, discrimination, education, access to health care, and environment. The likelihood of having asthma differs by race, ethnicity. From the data collected by MDH, we know that American Indian and African American middle and high school students are more likely than other students to have been diagnosed with asthma. Multiracial adults are more likely than other adults to have been diagnosed with asthma. Using accurate, credible data can help inform actions in communities and support positive changes for people with concerns about environmental contamination and health impacts. The Great Lakes Guide includes suggestions on how to advocate for change to address environmental concerns. This information should get ideas flowing for who to potentially connect with to discuss possible solutions. This example has to do with concerns about kids playing in potentially contaminated areas in a neighborhood. Maybe an older resident remembers past industrial uses of land and isn't sure if the property is safe. The Minnesota Supplement resources suggested here can help understand whether known contamination was identified and investigated in an area and whether it was cleaned up. A resource that provides a wide variety of location-based environmental information is called What's in My Neighborhood. MPCA and the Minnesota Department of Agriculture, or MDA, each have their own versions. While many locations found in What's in My Neighborhood don't necessarily pose any risk to a community, it is possible to discover sources of contaminants in your neighborhood. For example, with MPCA's What's in My Neighborhood, you can search for properties that were previously contaminated and those being investigated for contamination, or for facilities with air, water, or other environmental permits. MDA's What's in My Neighborhood contains information on known and potential sources of agricultural, chemical, soil, and groundwater contamination. After exploring the What's in My Neighborhood data, you may contact MPCA staff to get current information about a site you found or inquire about a property if you didn't find anything online. If the concern is about pesticides or fertilizer contamination, you may contact MDA staff who oversee investigations and cleanups of agricultural chemical facilities, agricultural chemical manufacturing and distribution facilities, wood treatment operations, plant and tree nurseries, lawn care companies, golf courses, and other contaminated sites. State agency websites offer a few ways to search for information on a lake or other body of water. In this case, you could search for surface water quality data. For example, let's say Rice Creek is of interest. You can search by lake or stream name on the MPCA Surface Water Quality Data site. Type in Rice Creek and look among the options for the segment of Rice Creek that you are interested in. Our last example, a concern about drinking water, shows you where to access information about the water you drink and resources for understanding water quality information. If your water comes from your city or other public water system, you can look up water quality information in a Consumer Confidence Report. Click on the link in the Minnesota Supplement to search for your community's reports. For each system, these reports explain where the water comes from, what's in it, and how you can help protect it. Water systems work with MDH to test drinking water for up to 118 different industrial chemicals and pesticides. The exact list of contaminants and the testing schedule varies from one system to another. It is not unusual to find substances in very small amounts. No water supply is ever completely free of contaminants. Other MDH resources can help you understand the data in the reports. Human health-based water guidance is a concentration of a chemical or a defined mixture of chemicals in water that is likely to pose little or no risk to human health. MDH's health-based water guidance values described at the MDH webpage are based solely on protecting against health effects. Other factors such as the ability to measure a chemical, the cost of treatment to remove it, or background concentrations are not considered. If you are looking to learn more about pesticides in your drinking water that do not have MDH guidance values, you can check for a pesticide rapid assessment, which is a very protective, health-based value to compare to drinking water concentrations when no other guidelines are available. Private well owners are generally responsible for regularly testing their water to make sure it is safe. The MDH website provides information on what to test for, how to test, what your results mean, and treatment options. MDA conducts nitrate and pesticide sampling in private wells throughout Minnesota and provides additional information and resources on their private well testing programs on their website. MPCA also oversees sampling of private wells in areas known to be contaminated, as you'll learn about on the next slide. If there are contaminants in your drinking water, or if you aren't sure, you may want to learn more through the Minnesota Groundwater Contamination Atlas. You can search the maps in the atlas by simply zooming in to a location of interest or search by name, address, city, county, or zip code. Clicking on a dot on the map or the name of the site from the search results will bring you to additional information about the site's contaminants, activities, and history. The atlas also provides detailed interactive maps so you can learn the extent of the groundwater contamination plume and download individual well data. You can also download all groundwater data for the site. An accompanying site story provides information to help understand where drinking water comes from, which may be from a different source than the contaminated aquifer. MPCA annually samples an extensive network of monitoring wells. These results can be viewed by zooming into the location of interest on the groundwater monitoring data map on the MPCA website by clicking on a monitoring point and then clicking the station details for the data. MDA has groundwater monitoring data that provides information on the occurrence and concentrations of pesticides. The program focus is to monitor vulnerable groundwater in the agricultural and urban areas of the state. We hope these examples help you to explore available data about contaminants in your environment. This information can inform you about possible exposures to contaminants. If you are experiencing symptoms, please talk to your healthcare providers. They can help with your personal care. If you have questions or concerns about contaminants in the air, soil, or water that could result in some kind of exposure affecting your health or the health of your family or community, please contact us. We can help you understand more about the resources discussed or help connect you to other resources that may be available.